Good afternoon, Colorado. This is Matthew Menza running for Colorado State Senate District 17. I am up here on a smoky Sunday afternoon. We're going to get about 3 to 6 inches of snow in a couple days, hopefully kill these fires, but the fires came back with vengeance last night. It's really unfortunate. I'm joined here today with a freshman mechanical engineering student, the future of STEM at Boulder, Colorado, CU Engineering, and she is an aspiring pilot, and this is a introduction to flying for her to see what she thinks and to get her involved. So say hello everybody to Sam Lale, and Sam, you can say hello too.
Hi, it's nice to meet you everybody.
Alrighty, so today we're going to talk quickly about mental health. So mental health, you've heard me talk about it a lot, and I'm pretty serious about it. We're going to do something about it when I'm elected, so it's a absolute that we're going to get that done, and here's why. 27th in the nation for mental health funding, 7 for suicides in the country, and number 1 for teen suicides. That's unacceptable. That's a pandemic in itself. Look, this is not a partisan issue. This isn't about Democrats or Republicans. This is about humanity and people. We have to work together to solve this problem. Right now with COVID-19, we're seeing a spike in all sorts of issues, from abuse, drug abuse, depression, all sorts of issues, and now is not the time to skip on mental health. We have a problem though. The lockdowns and the restrictions are causing a massive amount of funding gap in the state, and we have to figure out how to start making money again to be able to pay for these programs. So we need to think long and hard about all these emergency orders and about the fact that we have a lot of restrictions, and take a look at the science and see where we are with COVID-19. We need to get people back to work, people back to school. We need to get restaurants doing what they're supposed to be doing, and we need to apply common sense, but yet think about not being too risk adverse, because if we can't get funding back in the state, we can't get people working, we're not going to get people healthy. This is not a bipartisan issue. So bottom line, how are we going to do this? Well, that fast track money from RTD, that might be a good place to pull a lot of money, or all of it, and dump that right into mental health, and then we're going to have to just figure out the RTD issue later, because right now the time is to focus on what's important for Colorado, and mental health and the suicide rate is out of control. It's a pandemic in itself, folks. So let's be unified on this, let's work together, and let's do something about it. Thank you, and I appreciate your support, and I hope to talk to you soon. Bye-bye. How did that one sound?